The first of the projects is the Northwest Community Network. Northwest Community Network is an independent alliance of over 800 contact organisations. The network has been involving service users and carers in their capacity, providing a forum for community and voluntary groups to respond to and represent their views and concerns at a strategic and policy level. The network has worked with Western Trust and by facilitating consultation, responding to consultations, and to represent the views of its members. I would like to ask for a representative of the Northwest Community Network to come up. Scott. Okay, that's the first of the awards. Okay, I'm now going to hand over to my much more able colleague, Edith here, who will actually introduce on behalf of the judging panel.
The second of our group is the Eating Disorders Association of Northern Ireland. The Eating Disorders Association of Northern Ireland has been providing information and support for people suffering from an eating disorder, their families and friends, since 1992. They hold fortnightly support meetings, both for those with an eating disorder and for those who care for them. They also run a helpline and a one-to-one support service. May I ask for a representative of the Eating Disorders Association, please? Our next finalist is the Northern Ireland Dystonia Society Support Group. In 2010, the Dystonia Society held an information day in Belfast, and those in attendance were encouraged to set up a local support group. A small group of interested patients took up the challenge, and in June 2011, the Northern Ireland Dystonia Society Support Group was launched. The aims of the group are to develop and maintain a local support group in Northern Ireland, enhance the levels of information, support and guidance for those suffering from dystonia and their carers, to work in partnership with a range of statutory and voluntary agencies, and to increase awareness of dystonia and encourage fundraising. They are our smallest group today. Could I ask for a representative of the Northern Ireland Dystonia Society, please? Our next finalist is the Epilepsy Action Northern Ireland. Epilepsy Action Northern Ireland works to create awareness of epilepsy and is dedicated to lobbying for better services through government agencies and the Epilepsy All-Party Group at the Northern Ireland Assembly. The local services of coffee and chat groups, branches and volunteers provide the opportunity for people to come together in local community settings, obtain information that is accurate, and to make use of the face-to-face support that is available. The organisation also works in partnership with epilepsy nurse specialists to ensure that people in Northern Ireland receive the most up-to-date information about their conditions to help them through any day-to-day issues. May we have a representative from the Epilepsy Action Northern Ireland. Age Concern BERA has been in existence for over 20 years, having grown out of an existing senior citizens club. It operates from a village community centre, which is centrally located and accessible for all who attend. The organisation is a voluntary one, and its aim is to maintain and, where possible, to improve the quality of life in the community, particularly where older people's lives and well-beings are affected. May we have a representative from Age Concern, please.
One of those instances in all award ceremonies where someone is able to turn up, but we will make sure that this actually goes to the Age Concern bearer in recognition of their work.
Thank you. Next entry was from Positive Futures. Positive Futures is an organisation which works with individuals with a learning disability and their families. Their Better Futures project is aimed at enhancing the lives of older carers. This is a partnership project with carers, families, the South Eastern Trust, Carers Northern Ireland, Age Northern Ireland, and the University of Ulster. The group has the aims of improving physical and mental health for older carers through planning for the future, increasing social inclusion and community connections, developing coping skills, and developing new models of service for older carers. May we have a representative from Positive Futures, please? Our next finalist is NIE, the Northern Ireland Association for Mental Health, and the Mental Health Service Users Forum in the Southern Trust. These two organisations have worked in partnership to promote the recovery model within mental health. Service users realised that recovery was a continuing story for them and their families, and they realised that there was a bigger story to be told. A working group with service users at the centre came forward to make a film entitled Recovery in Action, It's My Life, It's My Way Forward. The whole process, from development to the final product of a DVD, was service user-led, and the stories of hope and success have been an inspiration to those who have watched it. May we have a representative from Neve and the Mental Health Service Users Forum. Our next entry came from the Action on Hearing Loss. The Help to Hear project provides people who are deaf and hard of hearing throughout Northern Ireland with access to information and support to improve the quality of their lives. The project seeks to reduce loneliness and isolation often felt by those with a hearing loss. Volunteers are trained to show individuals how to get the best performance from their hearing aids so they can hear more clearly and communicate more easily with family, friends, and colleagues. And volunteers also give information on services and equipment to improve the quality of life. The service complements trust services, and there have been good working links and relationships between the project members and trust staff, which ensures a good quality service for all patients and users. May we have a representative from Action on Hearing Loss, please? The next entry is the Causeway Older Active Strategic Team, or COAST. The Causeway Older Active Strategic Team is an interagency partnership which aims to improve the health and well-being of those 60 and over in the Northern Trust area. They ensure that the voice of older people is heard through representation on various committees and boards, arranging opportunities for older people to network with service providers, promoting participation and engagement, and raising awareness of current issues and services affecting older people. Over the past 3 years, approximately 600 older people have informed the COAST development process. COAST are also working hard to break down the barriers of isolation for older people in rural communities by providing outreach activities for all to get involved with. May we have a representative from COAST, please? Our next finalist is the Cruise Bereavement Care. Beyond Words is a partnership project between Cruise Bereavement Care and the Stroke Association of Northern Ireland. It's aimed at providing bereavement support to older people, including stroke victims, their carers, and people living in sheltered housing. Approximately 10,000 stroke survivors have a communication disability, which can add to the confusion and trauma of bereavement. To respond to this, a key aim of Beyond Words is to give stroke survivors with this disability a voice and a means of expressing through the provision of bereavement services tailored to their needs. May we have a representative from Cruise Bereavement Care? Our last finalist is New Lodge and Duncairn Community Health Partnership. New Lodge and Duncairn Community Health Partnership is one of 7 healthy living centres situated in areas of multiple deprivation in Belfast. The focus of their work is health promotion and early intervention. The New Lodge and Duncairn Community Health Partnership delivers a range of preventative health measures in neighbourhoods suffering from a range of health inequalities. These measures include nutritional and physical activity programmes, stress management clinics, schools, young people's programmes, women's and men's programmes, and older people's health programmes. Over the past year, 2,215 people have participated in these activities. It follows the principle of community development and capacity building. By working within and on behalf of the communities of North Belfast, the Health Partnership attempts to overcome barriers and obstacles to health information and services as a way of addressing health inequalities. May we have a representative from the New Lodge and Duncairn Community Health Partnership? As you'll appreciate from the short pictures we have been giving you, we have had 11 brilliant projects. It was very, very difficult to decide. There was much earnest debate because unfortunately we can only have one winner. So today I'd like to announce the winner, and that is Niamh and the Mental Health Service.
It's a celebration.